How is everybody?
Good.
Good.
Very tired. How are you?
I'm doing fine. Doing fine.
I heard you guys just got poured on.
We did.
Yeah, did you guys not get rain?
Not down here.
That's so crazy. Yeah, it was really.
Well, where are you, Kevin? Are you
Down in
someplace
Marshfield.
fun?
I do
nice.
the weekends down in my family's house down in Marshfield. And I
Oh,
always
that's-
say it never rains on Wrexham Beach. It's a rule.
Do you know how long you guys are staying there?
Till Monday.
Oh.
I come down Thursday with the kids typically. Erin has off on Mondays, and then she'll work. She'll come down tonight, work from the cottage, which is new this year, which is one good thing that came out of COVID. She'll work from the cottage tomorrow, so at least she's here, and then she has Mondays off. So
Oh, cool.
we always historically have stayed Sunday night because we didn't want to deal with traffic.
Mhm.
Right.
Not that that's a problem anymore, but we still
Right.
we still stay.
Hello.
Hi, Richard.
Rick.
How are you?
Good.
Good.
Yeah, I think Adam's parents wish that we were in Maine every single weekend at the beach with them, and we're kind of like, oh, sorry, we gotta stay away. But we try to go some and just stay far away.
Yeah, Maine's tough right now with they cracked down big time on rentals going up there. Have to test within 72 hours.
Yeah. Yeah. So, right. So it's not a rental because his parents are living there.
Oh,
now.
it's right. Your parents own it. Yeah.
We did
What
look
beach are they?
at this for new. It's near Biddeford Pool.
Okay.
So it's like an hour and a half away, but we looked at renting a place in New Hampshire, and they were like, you need to quarantine 14 days before you can come, and like bring all your own bed sheets and kind of stuff. So just interesting. to see. But who
I'm
knows?
going up-
Like in September. What?
We're going to Falmouth. I with all this is going on, I said, let's just stay within the state.
Yeah.
I don't want to do all this.
Right. I know. So, which is probably something that we should talk about tonight. I can't remember if I put it on the agenda.
I think you did.
I think I did, is just kind of update. Yep.
What's that? Go vacation?
You mean the updates on the agenda, or what we
No,
were looking at doing and may do and may not do? Yeah. Oh, yeah. We were thinking about vacation, but don't know if we're gonna do that or not. But I guess that's a good segue into starting the meeting, unless anybody has. Hi, Carrie, by the way.
Hey there. Hello.
So it is 7:03. I can go ahead and call the Board of Health meeting to order. Any willing volunteers for note taking? I would volunteer, but I know that I'm not going to get it done.
I will do it.
Thank you, Carrie.
Uh-huh.
You know, Jean, one thing that I've wondered about, I haven't asked Laura about this, but I have a ton of meeting minute like drafts. Is there any, I mean, you mentioned Amanda at some points. I know that I should be able to do my own meeting minutes, but I think I have some from like March or some obnoxious time. Is there any way I can send a draft to anyone and like have someone read it, or should I just figure out a time to sort of clean them up?
We're not all fully back yet, but
Okay.
but I can, if you have documents that you want some help with, I can figure out some help for you. Sure.
I mean, I'm not saying like, will you? I know that you were cleaning up some other meeting minutes, so I don't want to put that on you. But it's just an idea that I'm throwing out there, so we can talk about it offline too.
Yeah. Feel
We
free to
usually-
send them to. I can help with that.
Are we supposed to send them to you or to Laura? Because I just sent my last meeting minutes to Laura.
Oh,
I
no,
know
you're
she's a-
right. Yeah, she
Yeah.
might take the night off. I talked to her yesterday. She's like, I'm just gonna call in tomorrow. And I was like, no, you haven't taken a Thursday off and I don't know how long. No, Paula, you are supposed to send them to Laura. I just am so ridiculously behind on meeting minutes that they're already typed up. They're just not very clean. And I was asking whether anyone can like clean them up. So I was
Yeah,
taking my responsibilities as a way to get things moving forward instead of stuck.
send me what you got and we'll figure it out.
Okay.
I'll be on the cleanup committee.
Okay, so do we have any comments, Jerry? And I see that you're here. I don't know if you're here for any comments or if you're just listening or if anyone else has comments.
I'm just here to listen.
Okay, great. So first, I just had some updates and discussion points, just in case anybody wants to talk about this stuff. So we've already talked about the Massachusetts travel ban. I heard from Bob about this too, who had been in contact. I'm not sure if it was the governor's office or who was saying they're, absolutely cracking down on this, and that, you've heard about the $500 fee. So he may ask for some help with thinking about this in terms of employees returning to town hall or other municipal buildings, and should they play a role in sort of helping to monitor that people are observing the quarantine. So that's just kind of an FYI, an update there. I can't tell her
Sorry.
face is thinking.
Thinking. So I missed the beginning.
Yeah,
Who was
so-
thinking town hall employees should monitor self-quarantine?
Yeah, so the new travel ban that goes into effect August 1st is that anyone traveling to Massachusetts
Yep.
should quarantine for 14 days. I mean, this has to do largely, I think, with college students coming in from out of state. And I think that there are the low risk states that are currently on the list of I remember Maine is on there. I think Connecticut.
Maine,
maybe
Connecticut,
not
New
Connecticut.
York. Maine, Connecticut, New York, New Jersey, Vermont, Massachusetts. Yeah,
In Hawaii.
Yep.
and
In
Hawaii.
Hawaii, remember? Don't forget
Yes.
Hawaii.
Really?
That's
That was on there?
right.
Yeah, no, really,
Yes.
it's on there.
Thank you. So I think Bob's comment was more just kind of an update, an FYI, that he was thinking about, given the emphasis on making sure this is followed. He may ask us for input or advice about whether and how to help implement this in the municipal building.
Got it.
So there's no clear ask from him right now. It was sort of like an FYI. I might ask you about this later.
Right, and it's interesting because there was a lot of discussion about it on the local health call on Tuesday, and there are a variety of outreach methods happening. There's a lot of outreach to hotels, asking them to be sure and communicate with their guests at multiple touch points, and ask them to complete. There's a form that you have to complete. There's an online attestation that you need to complete. But they didn't, it was external that they were, it was external visitors they were thinking about, not vacationers. I know other communities have put into place procedures and said, if you leave and go to a off the safe list state, for vacation, when you come back, you have to quarantine, and you can't use sick leave for it because you made a choice to go on vacation.
Mm-hmm.
And I'm trying to remember what else they talked about. I mean, it's self-report. Everybody's supposed to be good citizens.
Mhm.
And then they talked a lot about how you actually do the fine, because 500 is above the normal threshold for fines.
Mhm.
So,
Mm-hmm.
but so he wants. Okay. He wants.
Oh, I think he's just saying, I've heard about this from many channels. It sounds like whoever he was on the phone with that day maybe at the governor's office was, again, emphasizing how strongly they want people to adhere to this.
Yeah.
And he just sort of said, as an FYI, I might touch base again with the Board of Health to see if you have any thoughts or recommendations about enforcing this in municipal buildings. So, I mean, one thing that he maybe was considering was if people go out of town or take more than 2 days off, should he make sure that they're not going to a high risk state or something, or make sure that if they are going to a high risk state, that when they return. So, I mean, that was just one idea floated out there.
Yeah.
So no,
I
like,
think that would be,
Car.
I mean, that would probably be a part of an internal memo from a reopening standpoint in general for employees coming back into town hall, right? So that should certainly be part of it, so that they understand the not only the risk but the consequence.
yeah. Speaking of an internal memo, so another thing that we had on the agenda for tonight is that a week ago, or whatever the date was, we approved the protocol. The reopening protocol was essentially fill out the Massachusetts checklist, have the workplace safety, and then we had intended to have a conversation with Bob about how best to communicate that. So we haven't at this point still had that. So I don't think that communication has gone out. So, I mean, Kevin, your point about an internal memo seems like a good way for him to communicate out that message. I don't know whether or not, I mean, I guess I would want to touch base with him, given that that's where I thought that we left it, if that's what everyone remembers.
Yes.
Then either the board can have our own communication and outreach about we've approved this to be the procedure for reopening municipal buildings, or we can wait. I assume we'll have Bob on command on Monday. And then at that
My
point,
recollection was that he was going to ask each of the departments to review their protocols to see how they measured up to the 4 main things that he's supposed to do, we're supposed to do. And they were going to submit alternatives if they could not meet them, or how they're getting around it to meet the protocols.
And
So
he
you-
didn't have a town hall protocol written yet. He was trying to write that himself, I think.
yeah, I think so.
Yeah, we had a draft that was put together by Matt Cornelis and HR. And I think they were waiting for, Bob wanted to have that updated and bring it back to the board. I think that's what I wrote down.
Yes. Needing to see that.
And so then, but, this may circumvent the need to do that. I mean, I don't want people to be working on sort of protocols right now that don't actually need to be reviewed. So maybe I can send him an email after this call just saying, I mean, we were,
I ask. Well, yeah, we have a note that you were
About
going
the
to come
other
back to us.
yeah.
Because he said that. He said, I'll have something for you on Thursday. And then,
Right, but I mean, I think they don't need to have something for us.
well,
I mean, they don't need to have the protocol that they wrote for us. They would need to have the checklist.
Yeah.
So I'll just circle back with him. Okay. Oh, yeah, that was the next thing. Okay. Oh, just as an update, I don't know if Laura Vlasic called everyone, just to touch base that we did have one location with a positive test. Okay, great.
Yeah.
And that was closed and reopened today, after a deep clean and 1 day off with new staff. Okay, so recreation. This is updates at this point. So Jenna heard that soccer got reclassified as moderate risk, reduced from high risk, and heard, oh yeah, Carrie.
Yep.
football all forms of football are high risk.
What, sorry, so flag football got categorized as high risk now?
All forms of football, including flag, are classified as high risk.
Okay, great.
And
And then soccer is moderate?
I was trying to research that. I didn't hear that on the call, so I don't know where that came from.
Okay, yeah, I hadn't seen it.
Yep.
Jenna hadn't seen an order. There was sort of chatter amongst recreation departments from other towns. So,
So yeah, I'm a Rusk parent, and they did send out something. They got it from their like corporate whatever entity that they all kind of pay into.
Yeah.
That said it was classified now as a moderate.
And I just pulled up a article. I just Googled it. New England Soccer Journal on July 24th says Massachusetts says soccer is moderate risk. Huh.
Yeah, that's at least the email we got. I didn't see anything official come through from the state, but I know they're all gearing up to play games.
Right. So they got dropped, but flag football it was very clear. All forms of football. So.
Okay.
And that's now part of that document that we've been looking at, Terry, from the state.
Those were words from the guy who writes the document, but we didn't receive the document.
So they got to update it still.
Yeah.
Okay. Okay.
Yeah, we'll watch for that. Jenna will probably send it to us when.
And I had a feeling that was going to happen. That's why I told them a couple meetings ago, don't get all geared up. Don't go crazy.
Any more about football, soccer, sports? Any other updates? No. Okay.
None that I know.
So does that mean that we're going to tell SNL that because they're high risk, and with high risk, I think the activity can only be, I think, level 1.
Skills and drills. Yep.
Right.
Yeah.
Yeah.
So we're just, that can't happen then in the town.
Right. And I'll make sure to circle back with Jenna, but I will do that. I'm positive that she's already communicated with them about it, but I will just double check.
Yeah.
I have gotten a lot of emails today that I haven't checked. So,
I mean, I have a feeling they'll probably still want to move forward with skills and drills. I suspect they would. I think they have a huge group of people that are interested in doing it. You can still pass and catch, right? You can still do like route running, skills in that regard. So there's a lot of things that you could do that you could still make it a fun program for kids. So I bet they're still going to do something. I'd be surprised if they just shut it down.
maybe, yeah. I think earlier that is not what they wanted to be able to do.
No, of course
We'll
not.
see. Well, now, given this, we'll see what they want to do.
Everybody's got to adapt a little bit.
Yeah. So agenda item is number 3, is meeting minutes.
You're plowing right through these.
Yeah, I know. Pretty good.
This is great.
Well, school reopening, that's going to take a while.
Yeah, sorry.
No, thank you. Thank you. I haven't read them. Sorry.
I have to go find them.
So
I have
maybe,
611
Sure.
and I had one typo. I can't find 622.
okay.
Yeah.
So I can go ahead and tell Laura, what's your typo for 611? Or you can tell Laura. Yeah.
Okay.
You can just email her that one and I'll email her mine, and then maybe she can send out an updated 611, and then I'll make a note that we couldn't find 622. I think she attached them all to one email. Maybe I can.
I'll go look for them. I just haven't.
Right now. It's okay. I'll forward it right now. It's from July 20th. So let me send that to everyone.
Okay. Thank you.
That brings us to reopening.
Oh, boy.
School. So yeah, Kevin was reminding us, so school committee is voting next Thursday, and I agree, it makes sense for the Board of Health to give a recommendation. So currently they have 3 proposed models that John told us about on command last time, the in-person, hybrid, and remote. I don't know if you guys had a chance to read through. Emmy Dove sent me oh yeah,
I did.
good. Great. Emmy Dove sent the Harvard guide to school reopening that.
You're talking about the Harvard one?
Yeah, Harvard School Public Health guidelines about how to reopen safely. And so I kind of was comparing that against the school. Do you want me to resend any of that, by the way? Would that be helpful?
No.
I'm just looking to see if I have it.
Yeah, I don't remember seeing it.
I think I sent it from my phone with in the forward, I wasn't sure the link came through. So let me resend.
I got it.
Okay.
What was the?
Oh, it's a link. I was looking for, yeah, I got it. I was looking for an attachment. Okay.
Okay, yeah, sorry.
What's the date? I can find it if I know the date it was sent.
I think it might have been this morning.
It was this morning at 7:42.
It was this morning.
Okay,
Yeah, I see you on there too. You're on there, Carrie.
I got it.
Okay.
Thank you.
So that was that was really the resource I was pulling from. I didn't look at, I don't know the last time the CDC updated their guidance, but I think this is more recent. And the only things that I see on that aren't covered in the reopening protocols for the school are, they have categories, the healthy buildings category, which is things like air filtration systems and then installing plexiglass, and then the healthy policies, which is creating a culture of shared responsibility, promoting testing. I didn't see that included in their protocol, which is no, fault of theirs. They were responding to the guidelines, but I wondered if, given that we're,
I mean, the questions about the healthy building probably needs to be held until command anyway, because do we know if all the schools have HEPA filters or?
So in a meeting about the Pleasant Street Center, Bob and I were chatting about the filters, and they have MERV 8 in the Pleasant Street Center. So I don't know if that's standard across all buildings.
Right.
Like it may vary by school too. I think I saw somewhere though that they recommended nothing lower than MERV 8. I didn't see what.
No, I said MERV 13.
Okay. That sounds right. Let me Google around on this document for MERV. MERV 13, right, in the Harvard guidance.
And I thought, other than that stuff, I thought they did a pretty good job of addressing all of the issues. I think the Harvard document made some suggestions that could be alternatives, like I'm probably dating myself, but I am of the era of when they had double sessions for the first rebuild of the high school back in the old days. We did double sessions, like the juniors and seniors went in the morning, the freshmen and sophomores went in the afternoon. So that was one of the alternatives that I thought was something that could be looked at as an option anyway, because that would drastically reduce the number of people in the building.
Yep. So I wonder, so the one thing that I remember reading that they had was they have cohort 1 or cohort A, or maybe it's like cohort 9, 10, the 9th and 10th grades are one cohort and 11th and 12th grades are one cohort. And I don't know what the difference is between the cohorts were. Oh my.
Those for alternate weeks.
Alternate weeks. They're using the alternate week strategy.
Of in-person attendance, yeah.
Okay, so that wasn't what you're proposing, Paula, the morning and the afternoon sessions. It wasn't that. Okay.
Yeah.
So the only problem with morning and afternoon sessions is you'd have to clean the school in between them if you're bringing two.
Right.
It doesn't really
True.
make a difference if you're not able to do that.
Right.
Yeah.
So that may be difficult. I think that's why they'd rather go with every other week, because then every Friday it gets cleaned.
Yep.
And then you also have at the intersection of the morning and afternoon, you have a lot of people coming and going
Yep.
at the same
Mhm.
time.
Yeah.
So there'll be another problem with that.
Yeah, I've been thinking a lot about this after hearing Dr. Doherty talk about what they're going to do. It's going to be a trial and error, no matter what happens.
Such a
It's-
huge undertaking. Huge
there's so many little dominoes that kind of fall based on different things that may or may not happen throughout the day there. That it's going to be very difficult for them to manage, and I hate to say this. I've thought about it so much, and this is not anything parents want to hear, but the more I kept thinking about all the different protocols that you need to put in place, all the different things that you're really doing to try to really protect people 100%. No, and I'm in a meeting. To try to protect people 100%, I just think it's unmanageable. I mean,
It's
I commend them for going back
overwhelming. It really is.
part-time, but it's almost, anything in the past that became this difficult, usually it was not worth doing. I hate to say it that way, but it's going to be difficult for them. So I commend them for trying at least to do every other week. I think, they just simply don't have the space for full-time all the time to stay 3 feet. From what it sounds like, they tried that and it's not going to work. So they really only have 2 options, and that's just kind of cohort A and B, flip-flopping weeks, or full remote.
Right. I would agree that the only thing that wasn't included was around the filters. The other piece is around testing, and there wasn't a whole lot of detail about testing one way or the other. The guidelines that got sent out, the DESE guidelines that came out I don't know, today or yesterday, that someone sent along, does talk a little bit more about testing when people are symptomatic and how you quarantine them and so forth. I don't know whether, I think the original guidelines from the state that John was, grading his preliminary plan for, said that they didn't really talk a lot about testing either. But it seems like in the final plan, I think there needs to be a lot more detail about, who does the testing? Is it the school nurse? And, and where is the testing done, and whose expense, and all that. I was also curious, which I didn't bring up, was around the idea of batch testing. It seems like if you have a cohort A and, let's say at least at the elementary and middle school levels, where they're pretty much, a group of 20 kids are in the same room. If they start the week and you do a batch test on them and it's negative, you could be reassured, for the rest of the week that at least that there's very low risk. But that would require, even though it's batch testing and it's only one test, it does require getting samples from 20 children, which could be a problem. So I probably don't want to go there, even though I thought about it. But some more detail about the testing would be useful.
Yeah, I hear you. And one thing that I circle around about is that we hear from epidemiologists that it's better to test everybody all the time. And then we hear from we have our public health nurse calling in, and from a clinical standpoint, you don't want to test people unless they're presenting with symptoms, unless they have a presumed exposure. So I don't know where to land on what we would recommend.
I think
We're stating that with no solution.
Right. I mean, I think the guidelines here just said test when symptomatic or exposed. I think those are reasonable guidelines that DE.
One of the things that I said in the Harvard thing, which I thought was interesting, that is because one of the what about the asymptomatic people? But they tend to be presumably have a lower viral load, so they are less likely to infect others.
Yeah.
So, but they're still out there.
Right.
And then you've got someone who is at risk, and that's a problem.
Right. Right. I mean, I do know
There's
that
no
you can,
good answer.
right. I do know that you can have people living in the same household, and for asymptomatic people, you can just have, that one person be sick, and even though they're living with others, the other people don't get it.
Sorry.
And so I hear you that if asymptomatic people have a lower risk of transmission, then doing the testing may not be worth the expense. I mean, I know, I teach at Merrimack, and we're requiring testing, I think it's weekly, but the way that they're paying for that is that the students are having to pay a testing fee, and they're just going to see whether or not the state will reimburse for it. I mean, they don't know at this point. So I don't know whether or not the FEMA or the CARES funding could ever be used to supplement testing. But I mean, you would want to make sure that it would be effective and useful to be doing all that testing, which again takes me to my earlier point about epidemiologists want everybody to be tested and clinicians don't want everybody to be tested. And I don't know all the factors and the reasons behind that. But I agree that we could at least have a little bit more information about who should be tested when and the protocol for that. I think DESE has some guidance about that, but okay.
Yeah, I didn't get a chance to read through those DESE guidelines yet, but I'm sure they must
I
have
didn't
something
either.
in there.
They were extensive. I skimmed it. I did not read it either in its
Well,
entirety.
and there are some, the challenge for me is that there are some deliberate differences between the DESE guidance and public health DPH guidance. That was also discussed on the call. Those were conscious choices. The piece that was referred to most was the 3-foot recommendation. So that challenges me. I'm not sure where to go with that.
Could you say a little bit more about the differences? Meaning DESE said 3 feet because they thought they needed to open schools, and DPH said 6 feet, or
No.
what are the differences?
So the specific example is that DESE guidance includes 3 feet. That is not what DPH has, right? DPH and public health standards are 6 feet social distancing. DESE says in the school setting, 3 feet is okay. And this was raised as why are these guidance documents in conflict? And the response was that that the state command has a medical advisory board. And I looked at the list of who's on the line. I know a couple of them there. And the medical advisory board reviewed and deliberately said, yes, we do want to say in the school setting, 3 feet is appropriate. We're willing to make that happen.
With
Sorry?
With
Masks, right?
With
Yep.
face masks.
Yep. So, and the local health was asking on this call, well, what do we do about this? How are we positioned on this? And I said, the school setting is the school setting, and that guidance is specific to the school setting. And there may be differences, and that is DESE's purview.
So, but the Reading preliminary plan, I think I kept hearing John was going with 6 feet. So
Yes.
what I liked about it was 2 things. One is he was going with 6 feet, not 3 feet. And
Yes.
probably because we can. I suspect there are school systems where it's impossible, to do 6 feet. And it's great that he thinks we can. The other thing that was, positive about it was the cohort C, which is that for parents who don't feel comfortable at all with the system, they can be complete remote learning, which I think is a great kind of safety valve in terms of the community being acceptable to having their child have whatever, they feel most comfortable with. So I thought that was a very
Yeah.
positive thing as well.
Yep.
I think in terms of, I don't know what the board needs to do for the school committee meeting. I mean, I think it is a preliminary plan, and there's going to be a final plan. I mean, I think, maybe we can comment that directionally we feel very comfortable in the way that it's going. We might raise about the filter question, and would want to see something in the final plan around that, and some more specificity around testing and who was do it and how it would be done. But otherwise, I think it would probably be more important for us to give a formal approval or recommendation with the final plan rather than necessarily this preliminary. That would be just my thought on it. I don't know how other people.
I agree with that. I like the idea of sourcing sourcing this Harvard document of, this is a resource. It's not the answer, but it's a resource. And, looking at how you mitigate exposure risk. And just observing about the more detail on testing. I agree that having the cohort C, acknowledging that there are people that won't want to, or can't.
Right.
I think that that's appropriate. And I am comfortable with all of those pieces. I hope they will review and speak to these questions. I think the rest of it was very thorough.
Agreed.
Yeah, I agree too. With seeing this as draft guidance, giving our suggestions, and then sort of reviewing again for the final. One other thing that I appreciated that they are still offering in-person services to those who are for example, homeless or food insecure, students with disabilities. One thing I wondered about was students with no internet access. I didn't see them specifically listed in that category. And I don't know if that's because they have ordered tablets and they're planning to give those. Well, I guess if they can have a tablet, that doesn't give them internet access. So
They were going to supply them with hotspots too.
Oh, hotspots. Okay, got it. So that's how they were getting around them. Great.
Yeah.
Thank you. I did send this, Emmy, I don't know if I told you, Emmy was the one who sent this to me, and I did share it with Command before I shared it to you guys. So I think it was maybe a week ago that I sent it to them. I'm sorry. I sprung this on you so late this morning. I was like, oh gosh, they should have that. Okay, so I think that sounds good then. We won't have anything tonight, or I don't know, Kevin, are you comfortable with not really having anything more tonight, or were you hoping that we could send them something in advance of the command meeting on Monday?
No, I figured it'd be good to start the conversation, because I know we haven't had a discussion about it. We just found out Monday that this looks like they're leading in this direction. They haven't actually taken a formal vote. I suspect this is the direction they're going to go. I don't think they're going to go full remote. They can't do full on. So I think it's most likely the direction they're going to go in, but I think that makes sense to wait to see a final draft. What might be helpful, and we can bring this up to with John on Monday, say, hey, do you want a few thoughts while you're formalizing that draft? We can talk to him about testing and probably best protocols just to help along. This is more just to kind of give some information from our side if they so wanted it. So I'm very comfortable with what Rick detailed for a plan. I think it makes sense.
Great.
And can somebody confirm, I thought I heard a rumor that they're going to delay the start of school 2 weeks anyway.
Sounds like it, yeah.
Are they? I know they
I
recommended.
think the 16th is the recommendation now. And that's for teacher training, essentially.
Great.
So it makes me nervous. It makes me very nervous.
The school's opening? I
Hmm.
know. I know.
I get it. And what are parents going to do who have to work and they have these kids that aren't going to school?
I know.
It's very overwhelming.
I know.
The problem with this is we don't have, we have even less data from school reopening than we do workplace reopening. Because right, as soon as this happened, everything shut down. So schools, kids haven't been in schools. There's zero, like literally zero data that says this is what's been going on. These are the transmittal rates. There's nothing. That's the tough part. I mean, there's no information to go on.
Right. I mean, and I looked at, so the DESE guidelines that came out, I guess in early July, they cited 4 studies from other countries that had reopened. And
Right.
I think one of them was this table of it was one of the ones that was evidence that kids under 10 transmit at lower rates than kids over 10. But it was essentially a table that had all the different ages, and then everything was 0 except for one age category transmitted to 2 people. And it's like, you can't really conclude that because no one transmitted anything except 2 people over 10 transmitted something, that the risk is that much higher for kids over the 10 than under 10. Like, I mean, there were 3 other studies. That was one of them that I just thought, I can't believe this is the data that we have to go on. There was another study in Australia that was a bit more controlled. I mean, I feel, I want to have 20 papers for one thought and a whole plan that's based on 4 studies, one of which is mostly 0 data. It's like, oh my God. But, you do the best you can with what you have in a pandemic.
Yeah.
That's right.
Okay, so that sounds good. Well, maybe we'll just bring it up to John on Monday, see if he wants any kind of thoughts of ours on the draft.
Yeah, I mean, I think it makes sense for us to provide our thoughts.
Yeah, I just thought, I figured they would want that kind of, some kind of insight into it.
Yeah, great. Any more comments or thoughts about that? No. Okay. Senior van.
I thought you just put it. I thought it was just left on there from like an old agenda that you just redrafted.
So
Did I mistakenly? I should have removed this a really long time ago, and I just forgot that we figured everything out, which may totally be the case.
Which totally could happen.
So I'll tell you, and I'm pulling up the links on my other computer. I went hunting, and the Mass Council on Aging has some guidance now, and they refer to CDC guidance about cleaning of non-commercial vehicles, I think. So there were 2 good links. I looked up too to see what had happened in Burlington, because I know someone was talking about Burlington's van had opened.
Yeah.
Right, yeah.
It is running, but there's no details about it, and I couldn't make a phone call. I could just kind of surf while I was listening to another call, frankly.
And I think
so.
was going to reach out to one.
Yeah, so I can forward those 2 links. I mean, there's at least some guidance on it now, the better than the DESE guidance. But I guess I don't understand what the we keep cycling back and forth. There's demand, but there's not.
Let's stop doing that.
We're not sure.
Let's see if I can do anything. Okay, to help. So the Board of Health closed the van, and although we haven't, Jean, feel free to jump into, we haven't reopened it yet because there hasn't been a great need. But even though there's not a large number of people who need it, it does seem like a very meaningful thing to use for the few people who do use it. So if there's a way for us to figure out how to open it safely, it could make sense to do so.
Okay.
And my thought is that if we could have people be 6 feet away, which is essentially a driver and 1 passenger in the back with the windows open, that's going to last for a while the weather permits that. That makes sense. I don't know about, I mean, they would clean in between users, but I don't know whether to allow any extra time in between. I mean, I think airdrop.
Yeah, I can jump in. So we have two vans. One's a person van and one is a 14-person van. And we also have the equipment to clean the van. And the driver has been trained in cleaning the van. And I think sorry, my connection isn't great, so I'm sorry if I'm mumbled.
You're
Jane,
good now. You're good now.
Yeah.
the two vans, what are the capacities of those two?
12-person and 14-person.
12 and 14.
And they're both wheelchair accessible, so that the way the seating is laid out, in the 12-person van, there's 3 rows of 2. And the 14-person, there's also 3 rows of 2, plus 2 seats in the rear that can be used, flipped down, or can be accommodated for the wheelchair. So the back portion of the van is for anybody that's in a chair. So the thinking was that there'd be no more than 2 or 3 passengers in the van, and they would be spread apart. And
Okay,
that these rides would probably be for anyone that has a need to get somewhere, whether it's to get to the supermarket, or in some cases it might also be, even though the van isn't used for medical rides, there could be a local medical appointment that someone could use a ride to, that this would be used for. The medical transportation provider that we've used for a very long time has gone out of business. And so we've been using Uber and Taxi for medical rides.
Does anybody have a sense of what the use is going to be given the pandemic situation? Any sense of that? I'm just thinking these are probably our most vulnerable people.
Mm-hmm.
I mean,
Yeah.
it's good to have something available to them if it's necessary, but at the same time, I don't see a huge use like before all of this.
Yeah, that's why I think 2 or 3 on the van is about right.
Does that include the driver? You mean like
No,
2 to 3
that's the
passengers?
passengers.
So I don't have any data
Yeah.
to back this up, but I still feel uncomfortable with even 2 high-risk people in that enclosed space, because it will be more than 15 minutes, probably. You know, once you get, if they're both using a wheelchair, then once you get one in there and then get the other one situated, that's already maybe 5 minutes. And then if they're driving anywhere more than 5 minutes, and
if they need assistance, then the driver is being exposed.
right. And so, you know, we haven't talked about this, but I mean, I think having the driver wear at least 2 masks, if not a mask and a face shield, because they're going to be in that close contact, really helping someone get on, and you can't have the driver be positive.
So I just want to share, I want to share the guidance from Mass Council on Aging, because they have specific recommendations about, depending on the number of passengers in the vehicle, and the capacities, and it's a little bit different than what we're talking about. So,
Are you emailing that now?
yeah.
could I also mention that in the DESI transportation guidance document that we got sent this morning, on page 14, they do have a model for a 14-passenger van and what they would recommend for students. And of course, students are not high risk. So, but they recommend 6 students and a driver. We may want to scale that back, but it sort of is alternating seats and so forth. But it'd be interesting to see what Carrie would they recommend.
Yeah. So I'll read it while it's traveling through the ether. So for vans, For 7 to 9 passenger vehicles, the driver should be in the front, no more than 2 passengers in the back, with each passenger exercising physical distance. For vans with more than 9 capacity for more than 9 passengers, no more than 4 passengers in a vehicle exercising physical distance. And then there's a install plexiglass if needed or driver compartment barriers.
Sorry.
So that's pretty specific.
Yeah.
And then they have hygiene protocols and so forth. So I don't know what their source is.
Yeah. I just wonder why. I mean, I hear you that those are higher numbers.
Yeah, I mean, and we certainly
I
have
don't like them.
I mean, we have the ability to do what we want. I'm curious why the council is going out public with these numbers and how they arrived at them.
Jean, do you think it would be cumbersome to have one person at a time in the van? I mean, do they typically try to have group trips, like everybody goes to the grocery store right now?
Well, and I mean, before COVID, yeah, we had a full van. So I think the staff feel like, the van driver is available, and we have the vans,
Right.
and they have the cleaning products so that they can, properly clean. And I think there's a few, a handful of people that could benefit from the service. And I think it's as simple as that.
Yeah, I guess I meant in terms of if we did say you can only have one passenger at a time, how bad would that be?
I mean, the big.
I mean, is that okay? Because then the driver's getting more hours and there's more time for the van to air out, or, sorry, I interrupted you.
No, I was just going to say, it's a large vehicle. It's, the larger 14-person van especially. And the windows, it does have some small operable windows, and the disinfecting machine is a, professional grade machine. So I mean, yeah, you could do individual trips. It would just be difficult to choose among the people who have a need. Who would you choose, and how would you choose?
Oh, I guess I was envisioning not turning people away, but just not having them go at the same time. Like, could it be that somebody has a 1 o'clock trip and then there's a 1:30 and a 2? I mean, I guess I'm asking about feasibility. Is that feasible, or is it like the van driver's available for 2 trips kind of thing?
Yeah, I'd have to get back to you on that to really answer that correctly.
Okay. And I'm just thinking out loud too.
Yeah, I do think that it would be good for us to have a rationale for whatever we decide to do, because if we said one person and, the van is this big monster of a thing, and they'll say, okay, on what scientific basis is that, well, it's we feel comfortable. Well, yes, but,
right.
I think when I look at this, the one for kids, which I agree, this is too many for elderly. But, there's a logic here. They have a map of where they would be seated, and they're 6 feet apart and so forth. Maybe we want to say for this high-risk population, we want them to be 10 feet apart, for extra precaution. But my guess is that even with 10 feet apart, you could probably fit 2.
Do you think so?
Or maybe 3, depending on if we had a visual, it would be helpful. This is what I'm going to hold this up. This is sort of what I'm looking at right there.
Right.
Right. This was a 14-passenger van. The red dots are where they recommend the students. The yellow dot is a monitor, if you want to have one, which is not relevant. And then the blue dot is the driver.
Right.
Maybe I'm envisioning the wrong size van, because thinking of a driver 6 feet away from a first passenger, 6 feet away from a third passenger, I just was picturing that couldn't happen. But if that can happen.
They have them seated like alternate benches and some seating near the window and the other seating on an inside. You actually have to assign the seats. That would actually be whatever we come up with. We'd have to say, this is where the 2 people can go, or this is where the 3 people can go. And we'd have a logic that we're, they're 6 feet or 10 feet apart. And we think that's safe enough with mask and ventilation, cleaning between. And I think the idea of a face shield for the driver is really a good idea, given that he or she may be very close to these people.
Great.
So they would also have to register for on the registration, they would have to do some attestation.
Right.
I'm just clarifying and confirming.
Yeah.
Well, I'm writing down. So we've got register with attestation, which also helps with the contact tracing at a later point. Face shield for driver. I mean, I know that's going to be difficult because if you really, depending on how close you need to be, if that's going to hit someone. But
They're soft. They are.
And then the number of riders is really to be determined by the length of the van.
Yes.
And whether, so we could either do, ideally, we probably all want to say 10 feet. And if you can fit 2 people in there with 10 feet, that's what we'd want. If you can fit 2 people in there with 6 feet, then maybe we could go with that too. So I guess we just need to know how big the vans are.
Right. I think we need to know, maybe get some kind of visual to scale of what the 2 vans look like. So
Yep.
We could see.
Jean, is there 1 van driver and 2 vans?
We have multiple drivers.
Oh, okay.
Yeah, and they're always parked down behind the Pleasant Street Center if you want to pop down there.
Yeah,
Both
both vans
there
are
right now.
Measuring tape.
It probably would be a lot easier if board members could make the time to swing by and look at them, because they literally
They're good sized vans.
Yep.
Yeah, they're not what you're thinking about when you hear van. They're more like big group party vans that people rent, and they'll take them down to like Foxwoods for the night. They're more kind of along those lines, captain seats kind of van, stuff like that.
I'm looking up 12-person van to see how many feet
They're probably on the website.
is a 12-person van.
Jean, where are the vans located? Where are they typically parked?
Behind the senior center, right?
The Pleasant Street Center. Yep.
Okay, so a length of a 15-passenger van is 18 feet. So our 10 feet rule wouldn't work, but it's possible that the 6 foot. Well, 6 feet would work in a 3-person van if you were having them 6 feet away from the. Although, if you're a catty corner, then right, it doesn't have to.
The diagonal is longer.
Right. I can't believe we're gonna go measure this van with a tape measure. Okay, so but we're thinking maybe the 2. Yeah, I'm not seeing the 3, but maybe 2 to 3 people. Do you think Kevin Bowmiller would know? or probably not. Anyway,
No, the size?
I'm not,
Yeah.
I'm
yeah.
not following you.
I just wondered if Kevin Bowmiller might know the specs basically, and then we can be sure that we can decide on Monday. Because it seems like we have, I mean, we've got like the 4, or no, just 3 criteria really to do the screening and have people register, to do a face shield for the driver, and obviously masks for the passengers, and then to make sure that the riders are at least 6 feet apart, although maybe 10 if we can fit that, if we can fit people in the van with 10 feet distance.
Sounds good.
You know, we
on
could-
the website, on the website, it says riders must be able to access the van with minimal assistance and adhere to the standards of independence for the center.
Does that mean they should be able to get on board with themselves?
Well, you have to know what the standards for of independence are.
Mm-hmm. Okay, well, I think,
Answer
So
that.
The document that I forwarded has links to 3 different sources on guidelines and resources for transportation standards in the top section too. So that can help with the rationale. Aha,
There you go.
oh,
they're spacious.
Very good. Yep.
yeah,
Yeah, and it looks like the one on the left actually has, it is, maybe it's not, maybe it's all open on the inside, but it looked like it could be easily cut off between the passengers and the driver.
Mhm.
Yeah. And then you could have people, I mean, on the one on the left, you could have somebody in the second row, you can have somebody in the back row easily.
Easily.
And I don't, it's, the angle's harder on the one on the right, but yeah,
I think the one on the right is actually longer.
is that right?
I think that's the new one.
Okay.
Yeah, I'm pretty sure that's the newer one.
I
Okay.
think it's the same van.
Is it really?
Yeah, this
From the other
is the
side.
new van.
Just from the other
We got-
side. That's great.
Different view. Yeah, I think so.
Okay. Okay.
Stand
Your
corrected.
local board of health, everyone. We'll be here all week, twice.
Well, well,
I
that van, I think I mean, I see easily that you could do a second row and a fourth row with comfortable distance. And I agree. It looks like you can barrier the driver's seat.
Would we be requiring a barrier? I mean, it does look like maybe it would easily fit. Are you talking about an actual plexiglass barrier? Or are we assuming that maybe there is something already in place given the way that it looks from the outside?
I was thinking that there was one.
It looks like the driver's in a separate cab, isn't it?
Yeah.
It does, doesn't it?
Yes.
I just don't know if it's, that cab typically has a window because that window is not there, and it's just so they can communicate to the passengers.
Right.
I would assume they set it up to communicate to the passengers during a drive.
Yeah. Do you all feel ready to make a decision on Monday? So I guess I'm asking, regardless of whether or not the cab can actually be separated from the back, do we feel like we can make a decision on Monday, or do we think we might want to ask for some type of separation to be installed before we would open the van back up?
Oh, can we all get down there and take a look?
We could.
Yeah, I'd say go take, definitely get down there, drive by, take a look. I don't think you really need to get in to see what you need to see. So I don't think you need staff to get you down there and get a set of keys. But I would take a look at it, and if I would say everything that you discussed and wrote down, Eleanor, as far as protocols for getting these vans up and running again is great. you can almost leave, we'd like to have a plexiglass barrier if possible, installed. It looks like it may even actually be already there. So, get down and take a look and see if it's there. If it's not, my guess is it'd be pretty easy to put in. So it'd be kind of not a demand so much, but an ask.
Mhm. I'd be fine with that. So, are there any more van thoughts for Thursday's installment of the van conversation?
You mean this is going to come off our agenda?
Nope, not till Monday. But maybe Monday we'll open it. I think the chances are high.
I like it.
All right, moving right along. Let's see, where are we? Okay, communication outreach. So we have, on Monday's meeting, you all probably remember that I showed a little bit of a draft postcard and a strategy that resident Teddy Asher had come up with. And Greg said, well, let's put together a planning team. And then Jean said, if you want to get out a postcard, you better have it done by this Friday. So so we had a planning meeting on Wednesday, and really useful and informative. Jane Wellman and Laura Jem were able to be there, as well as police, fire, the library, RCTV, Matt Granellis. I'm forgetting his job title. Sorry.
Administrative Services Director.
Administrative Services Director. So at this point, and then Jean was letting us know that the health revolving fund would probably be able to cover the cost of the actual postcards. The decision from planning was that we should have the postcards, given that it reaches a segment of the population that the social media posts or other means of communication just won't reach. So we're planning both of those. And so that's kind of an update of where we are now. And then hopefully by this Friday, we will be able to order postcards. So, but I want to get everyone's input. So we sort of were like moving at breakneck speed. So I want to get everyone's input and thought. So I can pull up the sort of draft postcard. And again, Teddy made this. She's not like a graphic designer. And let's see. So there is a graphic designer at the company that Jane Wellman suggested. Jane also came up with a logo. Let me see if I can find that. Oh, sorry.
Jean, did we find out if this is something we don't have to put out to bid? This doesn't hit that threshold, right?
Would be around $3,700 was our quote. So it's below that $10,000, but sorry, Jean,
okay.
I'm keep talking over you. I'm sorry.
Okay. My concern with all of this is the time frame for all the different pieces that need to happen to have this go out in time. So
the other part to keep in mind too is the state has actually, in a sense, already sent out a postcard, sent out the actual mailing that you can send back to your town halls to request the ballot, right? So yeah. That's kind of already been done. I don't know that you need to do a second outreach. I think for the most part, people are going to take that option or not. I don't know that us sending out another piece of information is going to change that behavior so much. But maybe maybe you do it to a smaller segment, to a segment of folks that typically are not social media, because I think it's the social media part that really can run with, because people can then repost it and onto their own feeds and what have you. So really encourage, hey, Board of Health is really trying to push voting via mail for these reasons, and have very specific reasons, talk about poll workers' safety and well-being and things of that nature. I think that's more effective than a postcard per se.
Well, I think that in terms of efficacy, so I think it was Jane Kinsella who said she definitely was strongly in favor of having a postcard because of the ability to reach people who we weren't going to reach these other channels. She's like, people
Sure.
stick on their fridge. And absolutely are wanting to have this communication through other channels too, such as, the Board of Health recommends for these reasons. So Jane Wellman recommended that the Board of Health do a press release stating the reasons why we are in favor of mail-in voting, given COVID. And then also maybe writing a letter to the editor of the local papers, something that could be put out through Patch. One thing that Chief Burns mentioned is it would be useful if the board could pass a motion indicating that the reason that we would recommend a communication campaign because of COVID risk, because of decreasing COVID risk, because if we do that, it provides more evidence that they could use in favor of getting possibly reimbursed from FEMA or the CARES Act, because this is something that the Board of Health said needs to be done for health reasons.
Okay.
And then Laura Jim weighed in, being very careful to be accurate about the way that we communicate. So originally the postcard, for example, said decrease the risk of COVID, and the point that Laura Jim brought up is that we don't want to dissuade. It's hard to get poll workers, and we want to make sure that we have people. The problem is, you can talk about we're having this really safe election. These are all the things we're doing to keep the election safe is one message, and another message is please do mail-in voting and don't come in person. So there's going to be a really delicate balance to find the right thing where you're communicating, please do mail-in voting, that's what we want, and not saying to people who are doing voting, you're increasing everyone's risk. So those are two hard things to manage around this.
Well, I think if you keep it strictly science data driven, that's the avenue to push out there. So numbers, percentages, things like that usually are good visuals for people to digest. So, I know, Eleanor, you talked about the 70% threshold.
Yeah. So I got that 75%. It was literally back of the envelope calculations from a table from a study that Emmy had found, which was comparing the voter density in towns that had this higher risk, which was 68% in-person voting, compared to towns that had the lower risk, which was 75% of the population voting, mail-in. And then Brian Healy, who was one of the resident advisors, had time to read the full article. And he was saying, I understand that way of thinking as a way of figuring out what proportion of people need to vote mail-in. But, the thing that you really have to keep in mind is just keeping density down inside the field house. So, no matter what proportion of the population votes by mail, if you have the density in the field house below a certain threshold, then you're minimizing risk, essentially. And so his way of thinking about it was not what proportion overall need to do mail-in, but what is the right number of people to have in the field house. But we really wound up just going with the guidance about 8 people per 1,000 square feet, because that was a clear number from the state.
I want to, I'm curious about the message for 2 reasons. And it goes back to Jean's point. So I agree, the message is hard. I've tried writing it to people, and it is challenging because you don't want to dissuade people from voting. And it doesn't float. But so my concern about the postcard and the timing is that we have zero reliability of when a postcard actually lands. That kind of bulk mailing stuff is at discretion. And I've done a bulk mailing, so that's hard. And I don't want us to get in the space where a thing lands late and it says vote by mail, but they've missed the deadline to put in their application to get a mail ballot.
Mhm.
So could we do vote by mail or early vote? Because the early vote is also, I mean, it's a alternative. It reduces the impact in the field house. And the spacing is a little easier, smaller and more easily managed. That would be I would like to see that, because I think it's a good message, and because I'm a little worried about the timing of the postcard, because I'd love to know when they can deliver it, and if the people that are printing it are going to be the ones who are going to mail it, because that makes it go really fast, but that's usually pretty expensive.
So so I haven't had a chance to read all of the emails. Laura, Jim, and Jane had sent emails earlier today. We were sort of worrying about with this. So Laura Jim says that the printer can print it directly on the card. And Jane was on the phone with the printer today and asked whether they could get back to her tomorrow, I think, to send the preliminary work to the graphic designer to get started on. So it sounds like the graphic designer, let me show you, let me just share my screen because it's a cool logo that he came up with.
So before we go too far, this has to be approved by command.
Yep. Right.
Right.
So, yep. So I sent, sorry, which part do you mean?
You froze, Jean.
Well, I'm just, again, worrying about, okay. Sorry, my connection's bad tonight.
That's okay.
No, I was thinking command meets on Monday, so it's probably not going to be ready for Monday.
You mean a final
Right.
graphic?
Yeah.
Right. I mean, maybe, right. I think Jane was planning to send it to the graphic designer tomorrow. And then what they would do is take this logo and add it to this postcard.
Mm-hmm.
But I mean, the board hasn't had a chance to weigh on any edits they would want to see on this.
Right.
And let me just check her here. I'm not still sharing my screen. Okay. I'll go check the command.
I like the logo.
Yeah.
Yeah. Did you talk to Jane Kinsella about including this on like a DPW bill, or I'm sure that's probably, it's probably too late, but.
No, Laura talked to Jane Kinsella about posting something beneath the stop signs. I can't remember, some type of sign that I think I remember costing $35. But we didn't talk about adding it with a bill or anything like that. But I do think that Greg may have put that on his list of things to consider. I think we mostly.
Can we do that with RMLD?
Yeah. Yeah, I mean, the town does all kinds of mailings already. So a much easier way to do this would be to include it on an existing mailing, but those mailings are queued up very far in advance.
Right.
But you never know. Maybe that's an option. It would be a lot easier and a lot simpler. And we could control that and make sure it doesn't arrive like, October 1st.
I mean, no disrespect
The
to the
mail.
post office. I just know
No,
that
but-
some postcards, I mean, they choose when those bulk mail pieces, when they want to deliver them. It's not like first class mail. So that would be the other way to go, would be to do a first class postcard mailing, but that's going to bump our costs fast.
Go ahead.
No.
Is your 7,000 pieces, is that net of all the cards we've gotten already? Because I know we've gotten a lot of cards already.
No, that's the database of voters for which Laura Gem has has addresses. So there are 20,000 registered voters, I think, but she has a database that has 7,000 people in it. So I guess I don't know what the difference is between, I don't know if the format is different for some reason.
So there's 20,000, but the postcard would only go to 7,000?
Right. I mean, she said that she has the 7,000 in a database.
Households.
Sorry?
The 7,000 households.
Holds.
Oh,
Multiple
right.
people
So
in one household, 2,
That's-
3, 4 voters.
that, okay. Yeah, I could see that.
That's why the number's different.
Mhm.
Yeah.
Okay.
What was my thought about that? Oh, and we just, to somebody's point earlier, we discussed segmenting and really only sending it to those high risk. And that was, I think it was Jane Wellman who thought that was a dangerous route to take. You're not necessarily sorting by people who are high risk. They might have other characteristics like diabetes or asthma that put them in a higher risk category. And it's better to provide that to everyone if we have the budget to do so, which it sounds like we do.
Yeah, this is more a timing, I think, issue than
Yeah.
budgetary. Yeah.
Right. And so the difference between first class mail, which is how people get RMLD bills, and I don't know what type of mailing, I assume whatever the typical postcard mail rate is what this quote is based on for 3,700. The difference there is that we would be concerned that this would arrive too late.
I mean, so I'm just looking now, and so the Secretary of State website says, vote. Okay. Says vote by mail applications must be delivered to your local election office no later than 4 business days before the election. So I thought that there was a earlier deadline than that.
August 26th is the deadline to
So the
drop
one
off
I-
your form to
Yeah.
town hall. Town
Which is 4
halls,
days.
however, keep in mind, aren't necessarily open.
Right.
For, I'm sure Laura probably will have somebody in there on the 26th, and you can drop it on the outside in the,
The mailbox.
what you call it, the mailbox, right?
Yeah.
I'm concerned. I don't think people are going to get it by the 1st, because then you have to have it back into your vote has to then be back and stamped down at the post office on September 1,
Right.
or it won't count.
Right.
So, what if you get it, your mail comes at 4 o'clock on September 1, and that's when you got the ballot. I thought that deadline, I didn't understand why the state did that. I thought it was way too tight of a deadline. There's way too many things that can go wrong with it. I thought it should have been more somewhere in the teens to drop off. But again, that's not our concern necessarily here.
Mm-hmm.
But it is the 26th, so that, I mean, you'd want something like this to drop 10 days before that.
Yep.
Because that's a tight deadline, the 26th.
So I'm hearing a lot of concern about timing of the postcard, and that the main drawback is acting so quickly. The need to act so quickly, and then the potential that it still won't be there in enough time for people to receive it. I mean, the thing that I'm balancing that against is it was mostly Jane Kinsella who was emphatic that the postcard is a necessary part of an overall communication.
I agree with that principle. I just think the timing is what's hanging me up. I absolutely agree. I would want a complete.
So then, why don't you just do it? Why not do it this way? You know, you have a command meeting on Monday. It sounds like tomorrow there's going to be some modifying the actual document itself. There's no reason you can't look at it over the weekend and decide before the meeting if there are edits that as board members you want to make to it or not. In other words, there's nothing wrong with continuing to push down the line, and then there's just going to become a point in time where great, it goes out, or you just pull the plug on it. I think that's, at this point, that's your best avenue. Just keep playing like you're going to do it until you can.
Which seems kind of like Monday. I mean, Jean was thinking Friday, tomorrow.
Which would be ideal. But I mean, if you use the right group, they do it all for you. They stamp it, they produce it, they send it out, and you know, they're typically really good about it. I know there's a company out of Woburn that does this a ton. So
Jane mentioned Woburn.
So they're like a machine over there.
Maybe Jane could get some information tomorrow if she's in or around. You know, so that for Monday morning at the command meeting, we'd actually have from the company, the distribution company, we'd actually have, we would actually know. Because I think there's an angst about the timing, yet we don't have any solid dates. Like if we say go on Monday morning, you know, can we be certain from the company that, you know, Jane talks to tomorrow that they can get it out by Wednesday? I don't know, you know, something.
Right.
A lot of unknown here. Why can't we know that?
Right.
If no, we can. That company's is really good, actually. I think that probably their turnaround time would be a few days to where it's in the mail. So if you have a yes on Monday, there's no reason it can't be in the mail Thursday, and then you are hitting it. You know, it should be landing then by the following Wednesday to everybody, if that's the case. So that puts it kind of in that teens of August range.
Okay.
And if they could mail it at the Reading post office, maybe that will cut a day off, as opposed to mailing it at the Woburn post office, which then requires another day to get it, or two to get it to Reading to be sorted.
Sure. Yeah.
An interesting thought. Yeah. I will go pick it up.
Yeah, so I you know,
but
take a look at the finished product.
What?
Take a look at the finished product tomorrow. Sounds like they're going to have a draft for you to look at, and then you know you have over the weekend to decide if you want to modify that from a language standpoint or reduce it, so it can be ready for command on Monday, and then you'll either have it ready or you won't at that point, right? I think you really would need to probably get something approved early on next week, Monday or Tuesday.
Yeah. So I'm
command doesn't have to be meeting to approve something. They can individually approve it, email wise. You know, it doesn't have to be during a meeting.
Yeah, they. So I'm just going to plan to forward everything to you all, just as an FYI, but kind of when I get it.
Okay.
On this, and then I'll also let you know. So I asked command earlier today, basically for an approval about the budget. Like, could we spend this money to do this? And then, as Jean has suggested, code it as a COVID expense. So I can let you guys know all about that.
Okay.
Oh, wait, sorry, Jean, I see another, I would suggest, Jean, I'm seeing another email from you that I hadn't brought up during the meeting about how will postage be handled. Have we talked about this yet, or is there anything here to continue to talk about? Suggesting a permit number be printed on the cards? Oh.
I think what I saw on the chain was that this company would cover everything. I was just verifying, does that number include the postage? Because postage doesn't come out of my budget, that comes out of a different budget. And I would
Okay.
certainly not want to have all these postcards run through a postage machine at the town hall.
Right. Got it. Yes, that quote
Now,
did.
is it Connolly? Yeah.
I think so. Yeah.
Yeah, so they do the postage, yeah.
Great. So would you all be comfortable with a motion from the Board of Health in support of communication in whatever form that takes to residents to encouraging vote by mail given the current pandemic?
Yes, sorry. So I just want to go back to my thing of are we also encouraging early voting, or are we putting it just on vote by mail?
We can have a, let's.
I
decide.
don't know what people think. Right, that's what I'm asking.
I had in my head.
The two are kind of counterproductive, aren't they? So in one instance, we're saying, please go to the library and do the early voting in
Right.
person, but please mail in your vote.
Yeah, I mean, I would
It
lean
seems
towards just
counterproductive.
mail, like everybody mail it in.
I would stick to just the mail in, yeah.
Okay.
Is that,
Okay.
but do others have different ideas?
I think that's a cleaner message.
Yep.
Yeah,
Okay,
I mean, what I've told people individually is vote by mail. If you
Mhm.
must vote in person, early voting's available. And there's been lots of work to make sure that the field house will be a safe setting, but
Yep.
that's how
Yeah, which is, I think, is a good way to put it, Gary. Yeah.
Yep.
I
agree
think for
too.
this though, you don't want it to. I just wouldn't want to see it. It's when you have a conversation with someone, it's easy to convey what you
Absolutely.
just said. When you put
Absolutely.
something in text for people to then determine on their own
Absolutely.
is where some things get lost. So I think, you keep it simple and just,
Yep.
we're encouraging mail-in voting. As,
Here's why.
if you can.
Yep.
Yeah.
I will make a motion for the Board of Health to encourage residents to vote by mail due to the current COVID-19 pandemic.
I'll second that.
Thanks, Paula.
There you go.
Roll call.
Paula, yes.
Eleanor, yes.
Carrie, yes. Sorry, I'm writing things down. It's very hard to participate and write things down.
I'm
It
sorry,
is.
Paula. I think that we're not allowing you to think and talk as much because you've been doing all this note taking.
Doing it,
And-
Carrie is.
Oh, Carrie, you're doing the meeting minutes. Sorry.
That's what I'm saying. Yeah, that's what I'm saying. It's hard to write all this stuff down and participate. That's it.
Sorry. Sorry. Along those lines, so something that Jean and I have talked about, I know we've talked about the budget a lot, the $30,000 that the town manager set aside, and then the $15,000 from the 2 grants from the state, and adding possible admin support for things like meeting minutes, tracking, documentation, spreadsheets, all that kind of thing is another possibility. So right now it's sort of slotted for a part-time nurse. So just reminding everyone that that's another possibility.
Okay.
I'm going to the meeting minutes again. Okay. All right, you guys, we're getting close. We're getting close. Kind of. We got 2 more agenda items. And so, Carrie, we had on here the COVID website. And
Yeah.
of that, I don't know if you are ready to touch base about that tonight or.
I am not. I have the snip still up and I've been marking it up, but it's not complete. I mean, all I'm doing is going through them and it's link checking, which would be fabulous if we had an admin who could do that. it's link checking and noting which things need to get pulled down. Then, and I have the blurbs written, which I think I shared a couple meetings ago.
Okay.
That's fine. And it was I have it scheduled for this weekend to spend a couple hours and finish up all the snipping and send it to Jane Wellman. And I would CC, because that was what we had talked about last time, was just clean it up. So I'd send it to Jane, CC Laura and Jean, so then they can send it all to you if you want to see what things I think we should delete. I'd love it if we could get like a schedule. Maybe that can be part of the monthly updating meeting thing, is the checking links, making sure we're up to date on what we're adding. Because we've got decorate your door for Memorial Day up there. So
Right. Yeah.
Yeah.
All right. So what do you, I hear you that it would definitely make sense to clean up the website and take down the things that aren't relevant anymore. I wasn't quite clear what you meant about to have a schedule. You mean for when things get taken down on what date?
No, I was thinking if we could add it as a standing agenda item on the monthly update meeting, and just have a quick eyeball if people have it in their mind. Is there anything they really want to make sure gets added to the website? I think that would be a very helpful rhythm.
Got it. Yes, totally agree. And then I have a couple, I made a list of just like links that I would cut from that COVID page, so I can just send that to you.
Great.
Or I can send it to Laura and Laura can send it to you. Eleanor, send to Laura.
Thanks. Thanks.
Okay, so return to new normal. Can I go do that one last, and can I skip down to enforcement for a second?
Sure.
Go back to the return to new normal. So this is something that we've talked about quite a few times, and I probably need to be able to wrap this up with a bow a little bit better and have some clear ideas and suggestions. So I don't know what other towns have done. Maybe this is something where this was originally, Jenna brought it up because of a field event that took place. So I could ask her what she knows about other towns starting to implement any fees for non-compliance with regard to recreational activities. But I do think that I don't know if others have.
So can I,
Yeah.
let me ask you something real quick.
Yeah.
This is in regards for them, them not doing, using social distancing guidelines and stuff like of that nature. So is that where we're going? This isn't just them, they use the field and they're not supposed to, right?
Right.
That's not us. That's a rec.
Not.
That's not really, I don't think that falls under the Board of Health purview.
Right.
That's a rec thing.
Right. It's using the field when they're not supposed to, and not having submitted a COVID protocol that was reviewed and approved.
Okay.
So I think she was kind of wanting the Board of Health to offer a little bit more oomph behind enforcing that people who are following the rules and going through the whole process to submit a protocol that we approve is fair, because we know that people are using the fields in the correct way. And so the rec problem, I hear you that if they're using the fields and they're not supposed to, that's a rec problem. But if they're also not following any guidance that we would have made them do if they had gone through that procedure, is there a separate Board of Health fee or fine or enforcement of, in addition to using a field that you're not permitted to use, also you didn't follow any of the COVID guidance? And so the board would weigh in on that second portion.
Do we have legal ground for it?
Well, we do have fines. We have a structure, a fee structure for Kevin, the fines that are springing to mind, because we've just done the most recently, were the pesticides, where if you use unapproved pesticides on your tree lawn, so the space between the sidewalk and the road that are high in a certain type of pesticide, then if there's like a first offense, then we send you a copy of the educational material to let you know what pesticides are approved. And if there's a second and third offense, then we have sort of a fee schedule that increases up to a certain point. So that's kind of a similar type of policy that we put in place for another public health issue. So at some point, we are going to need to think about COVID and whether or not we do something similar.
So I guess to Paula's question, we need to know, can we impose a fee? Because you didn't comply with what we've asked is that, you send us out a schedule of this is what we're going to be doing. This is how we're going to handle this part of social distancing. This is, all the protocols if they don't send us that. So that's something we need to find out probably from town council would be my guess. I think before we start going into it too thick into the weeds, let's first find out if we can impose a fee.
Okay. Yep. Because you're thinking maybe COVID is a separate case. It's possible.
I'm just thinking from, again, the Board of Health can close the fields, right?
Mm-hmm.
So I guess in a way we probably would be able to fine for using them improperly. But we'd want to just, again, I just don't want us to go too deep into the thick of it and find out, oh no, no, you can't actually do that.
Yeah.
So we should just should be as simple. I say this and I can hear Ray laughing as I say it. It should be a simple question to ask our town council.
Never.
And I'm picturing Ray right now laughing hysterically at me.
Right.
But let's just send them, send that off and ask them, hey, we've been asked to help the rec department for people improperly using fields. Are we actually able to impose a fine as the Board of Health for them not complying with a prerequisite that we have requested of all organizations when they use the fields?
Mm-hmm.
Carrie, do you know if there's a state precedence around this?
I mean, so there hasn't been a lot of talk about enforcement for the recreation stuff, but the standard is that there's the escalation grid, and that the first time is educate and
Right.
and try and deal with it locally, and that if you need to involve Department of Labor Standards or police, depending upon jurisdiction, that the state will help through that process. And I don't have anything in my notes about specific to enforcement on the fields, but I think it falls into that same.
Have they talked at all about enforcement for other issues? I mean, like one thing we haven't seen, maybe because we're going to transition to monthly health agent reports, is that we haven't seen our complaint spreadsheet not the complaint spreadsheet. We used to have the open and close spreadsheet, but we haven't heard an update about complaints. It sounds like there was one complaint recently that we want to investigate. And, it's just bringing to mind that maybe we want to put something in place where we have regular updates about complaints, and then because really this escalation grid is going to come into play when we have multiple complaints about the same issue. So I think we want to have a sense of what are the complaints, how many, what are they about, and any instances where there are multiple complaints and we need to escalate it to something higher. It would probably make sense to have a plan for if we get to that point, what do we do?
Right. I mean, because the recreation, just to go back to what you're saying, Paula, the recreation stuff that has been discussed on the enforcement, that's been about businesses choosing not to comply with the what was an order to be closed at that point. So driving ranges, gyms, different things like that. And there was a lot of local health asking for assistance in those instances. But that's different than this on on the town fields. That has not come up.
And, it seems like this escalation idea really doesn't, it would seem it wouldn't work well for events on town fields, because usually those are one-time thing. And so you're going to say, this is a warning. Yeah, and that Boy Scout thing will not happen again, and you'll be done. I think the escalation is more businesses where the barbershop doesn't have, or the restaurant doesn't have, adequate spacing or whatever. All the state-driven, requirements. Seems like we ought to have a more, if we're going to be looking at fines or an escalation thing, shouldn't it encompass everything? Should it encompass all COVID-related issues, whether it's businesses, the rec, whatever.
Yeah,
that's a great point.
Yeah, I totally agree. So I think that this came to our attention because of an event that happened on a field, and you're right. A lot of them are one-time events. Some of them are, it might be the same organization.
Right.
Having soccer practice or something out of compliance. But I definitely think that we want to think through not just fields, as you're saying, businesses, complaint, any of these types of complaints that we might hear. So why don't we can take a look at, so I can circle back with town council. And then we can look at I'm going to have to remind myself of the fee structure that we have in place for some of the policies on the Board of Health website. So I'm going to familiarize myself again with some of those, and maybe can come up with a proposal that would really just be a draft starting place. If we hear from town council that this does indeed make sense for COVID related issues. Does that sound good?
Yes.
Okay. Great. Okay, so the return to new normal. Okay, so this master plan 1 to 5 years is something that came up in conversation with Bob about, we have a new board. We have sort of a start where it gets a new start in a way. And he mentioned that in terms of timing, and Jean, you mentioned this before too, that the budget for the year for the health department for the year, and I don't know that the Board of Health really has a budget. I'm not clear about that distinction, but Bob was saying if we want to think about our master plan for the next 1 to 5 years, this is a good time to start doing that, because it sounds like August planning and then maybe having something by September or October for example, administrative assistant, that interns. I think you all received a forward from Nancy Doctor, who's a resident who was suggesting the use of interns. I also received from a colleague who's on the Academic Public Health Volunteer Corps, which is a program where they're connecting MPH students to local boards of health during coronavirus to help. Carrie, are you doing that? Are you leading that?
Yeah. No, not leading it. Just did it. No. No. But yes, actively engaged. And actually, that was part of how I started talking about the Board of Health. Talking about joining the Board of Health, and sort of started conversation with Bob. Yeah, I mean there is a good group. It depends on how you use them.
Right, and his so you all saw Nancy's email. I don't know if you saw that forward, just suggesting the use of interns, and then the town has historically not used interns unless they're paid.
Yep.
So his point about the budget is if you can kind of propose that in advance, then that would be something where an internship makes sense. But our policy has been to have the paid internships.
Mm-hmm.
So that's something to keep on our radar there. I mean, it sounds like the academic public health medical core, I'm not remembering the exact name, those aren't set up to be paid, but.
No, but there's you can do an internship through any number of schools of public health.
Folks, not to interrupt you, I'm having a little bit of a emergency over here, but I got to go.
Okay.
I'll talk to you later. Okay.
All right. Bye.
Hope it's okay.
Everything's okay. Bye. Oh boy.
Yeah.
Okay. Sorry. Right. So,
So this is not.
So you can get interns, right? I mean, you can get interns through schools of public health, and you can choose to pay them or not. The volunteer corps maybe is a little bit different, but so paying an intern, is that, so the question is, would that be part of a 1 to 5 year plan?
Yeah, I mean, my understanding is that right now, the way things are set up is that, if we want to consider having an intern, that would be something that we would put in our plan so that we would have a budget in place to pay that intern. And an intern could do things, I mean, one thing that I've been thinking about is loneliness among the elderly. I remember that's one thing that we saw pre-COVID was one of the top 3 risks for, I think it was early death for seniors, was related to depression, mental illness related issues, was one of the top 3 public health issue problems that was revealed from a community needs assessment conducted by Winchester Hospital, but they included Reading and some other surrounding communities. Actually, I should probably forward that to you all. And I mean, it was conducted a couple years, maybe a year ago, but I'll forward you that. But that might be the type of project that a student would work on given COVID. I imagine that the seniors are experiencing a lot more loneliness. So that's potential.
So this feels like it's a shorter term discussion. I'll say that an individual intern from a school, you have to have a supervisor. So there has to be a willing supervisor who will take them on. And students are a little bit of work, but they're good too. They are work.
I know.
Right. We know. You know. Right.
But yeah, good work.
But whereas the academic health department volunteer corps, those students are supervised by a team lead designated, because they recognize that that's a real barrier for many departments to take on a student. Nobody, especially in COVID time, has said, yes, I'm loving to take on a student and teach them everything they need to know. So okay. That's a plus minus to that. But again, that's kind of in the one range. And I'd love to kind of talk about how we arrive at a 5-year plan. I think that is a admirable and important goal to think about.
Well, Jean had, by the way, feel free, Jean, to stop me here and add anything. I'm sort of relaying part of our conversations. She had suggested MAPC. I can't remember what it stands for. It's a planning.
Metropolitan Area Planning Commission.
There you go. Yeah, do you want to hop in?
Yeah. I've done a little bit more research with, I think I might have mentioned a colleague of mine from another community that I talk to pretty regularly. And so it turns out there are people that she would recommend that do this type of master plan document. She called it something a little bit different, but something about needs assessment and health improvement plan. I
Yep.
guess is the current term for it.
Okay.
And she gave me 2 or 3 names to that she would recommend that I guess are pretty stellar in the field. Not that MAPC isn't, but this is all these people do.
Well,
So
I'm glad to hear that, and I'm going to push back a little bit, Jane, on MAPC because I have done some work with them, and they're great in transportation planning. They're great in a lot of things. Public health has not historically been a strength of theirs. Yeah, it's been something that in the field is a little complex and it's different. So I'm glad to hear that you got some great candidates. That's good to hear. Yeah, there are people out there who do this. And can help the board, get a handle on what the community needs are and where directions of improvement would come from. It's a worthy effort. I didn't want to jump in and suggest that in my first month. I'm going to wait till August.
But meeting, Jane will have a list of 8 things to recommend of how to pull that up. So this is something I imagine, Jean, that we would want to put in a budget if we're starting to discuss a budget for August or September. I'm not quite sure when that budget discussion would happen, but we would want to put a ballpark figure in if we wanted to do this. I think the people who specialize in needs assessment and health improvement plan sounds perfect.
Yep.
Yeah, I've actually already started working on my FY22 budget. So
Cool.
What's the
time is
submission
now.
deadline? What's the submission deadline for that, Jean?
Well, we start, usually we have a finance committee meeting in October that kind of kicks off the budget process.
Yep. So you need to be settled in September.
Yep.
Yeah.
The fiscal year.
Yeah, I like to get.
Is the fiscal year a calendar year? Or is it?
No, the fiscal year starts on July 1.
July
So
1?
fiscal year 2022 will be next July. It's the June 30th part that is the year. So like we're in fiscal year 2021 right now because it's June 30th, 2021 is when the year ends.
Okay.
Got it. I can't remember what I was going to ask you about that. But okay.
The way that I would suggest getting a scope of work and getting some examples, maybe from other work that has been done. I can definitely reach out to the names that I got and start that process if you'd like me to get going on that.
Yeah.
And see some
Yes,
examples, and it's about getting a scope of work and then putting a budget together and that kind of thing. So I can work on that.
That sounds great.
Thank you.
That reminds me, I don't know if everyone has had a chance to read the currently active strategic plan. It was from 2015 to 2020. Jean, I tried to click on it the other day. It still wasn't up on the website. I can forward it to people. If it's not up right now, I don't know. We're right at nearing the end of 2020, but it might help to give people a picture of what, we might think about going forward.
I respectfully, I hope we'll think about that and more. That plan left me wanting a lot more. It was kind of the tip of the iceberg of public health needs. So
Do you
I don't want us to set our bar too low.
All right. Do you think that the 10 essential public health, I can't remember what they call it, services?
10 essential services. Yeah.
You mean basing it on that is setting the bar too low, or sort of the criteria used to assess performance in each of those?
So 2-part answer. the criteria, I think, and the recommendations were a little thin. I would like more. There is a very healthy conversation in the field right now about whether the 10 essential services are the way to go or whether we look at foundational public health services. And the blueprint for excellence, which was from the Special Commission on Regionalization and Shared Services, actually chose to go with the foundational public health services model as opposed to 10 essential services. So,
sorry, the foundational public health services.
Foundational public health services, yeah.
Okay, great. Thank you.
Yeah, they're not hugely dissimilar, but the 10 essential has some limitations that the foundational work nicely with filling in. So
great. Well, you guys made it to the end of the agenda. Look at that.
move on.
So then the last thing I'm going to sneak in here at the end that I've talked about with Jean, but I haven't talked about with you guys is that throughout, well, Rick, maybe you didn't know this. So throughout this time, I have said that in the fall, my professional life will shift. So I'm a professor and I'm going to be teaching 4 classes this fall, which is more than I've ever taught. In addition to that, I have some research responsibilities and doing committee service for that too. So at that time, I was planning to shift my role. And so previously we were planning to have a board reorg at the end of August, but the school has actually moved up our start date to August 24th. So we're going to go from August 24th to Thanksgiving in person. And so we've tentatively rescheduled the board reorganization to August 17th.
And it's posted that way.
Oh, okay. So it's not tentative.
It can always be changed. It can always be, but I wanted to get that up and posted.
Got it.
Is that something, I'm not sure what you mean by.
What do I mean?
Yeah,
you
don't have to give me a line. If there's something I could read or something that would be helpful.
Well, that's basically where we just choose a chair. So, and a vice chair. And you know what? I now, Carrie, are you the vice chair? Did we choose a vice chair?
I don't remember. I don't think we did.
So,
Garrett.
well, Jean, does that mean we need to put that on the agenda for next time?
I wouldn't worry about it.
Okay, so it's essentially where you choose a chair and a vice chair. And then if you saw the MAHB guidebook that has in the first chapter, it has the duties of a chair. But I mean, it's the stuff that I do. You set the agenda in collaboration with the health agent, among others, run the meetings, among other things. So you can see that list for the chair. The vice chair responsibilities are not in the MAHB guidebook, but that person would step in the event, for example, that a chair couldn't attend a meeting. So we typically have a chair and a vice chair at this board. We are moving at breakneck speed and forgot to do that this time, but that's what we'll do on August 17th. And we can either have people nominate themselves or someone else can nominate a person.
And so, August 17th is 2 weeks from Monday, so it'll be here before you know it.
Okay.
Never a dull moment here.
Never.
So, Eleanor, did I read the minutes correctly to say that you would only be able to attend one meeting a month starting in your new role? That was what I saw in one of the minutes. But those minutes are, yeah.
So that is what I was thinking at the time. And I'm still thinking about it and have given this a lot of thought. I have not come to a final decision about it, but have really been thinking I wasn't planning to tell you guys this tonight, but I'm wondering whether it makes sense for me at that point to step down instead of just step back to one time a month, because of the frequency with which we're meeting now and the fact that I would be joining once a month. You know, I mean, I love this board. I love this work. It's ridiculously time consuming right now.
Yep.
And I am optimistic that, you know, as we continue to you know, implement best practices and move forward with planning, that we can reduce the frequency of those board meetings. You know, this is not what other towns are doing. So I think, you know, supporting the health department and getting the right balance of the role of the board and the role of the health department is going to be really important, because we're in phase 3 right now, which is going to last months. No one knows how long, but, you know, if we're waiting for a vaccine, then we really need to have a meeting schedule that makes sense for everybody who's on board. So yes, Carrie, you're correct that what I was hoping and thinking was that I could cut back to the monthly meeting.
Mhm.
I don't know how feasible, you know, that's a few weeks away. I don't know how feasible it would be for me to be a responsible board member who attends once. I mean, I can always read meeting minutes, especially if we have an admin putting them up there quickly.
Not meeting minutes.
So I'm just sharing with you all. So those are my thoughts where I am now.
Okay.
You're
Thank you
welcome
for sharing that.
to share back or not. Totally fine. But that's what I'm thinking.
Okay.
And then if I did step down, open meeting law no longer applies. So I think one thing that so Rick, you didn't know the previous chair, I mean, or actually maybe Paula, you didn't know the previous chair
No.
either. So Emmy was the chair at the beginning of COVID, and she had been chair for maybe 5 months or something, but maybe 4 before coronavirus. And she and I, when she stepped down, you know, we had been on the board together, and so we were able to communicate more directly with one another. So I think that really helped me get up to speed and be able to perform that chair role. So anyone who was in that role after me, whether I'm on the board or not, I would love to continue to do that. I know it's been really incredibly helpful for me. So I would absolutely want, and I would want to still be involved. Even if I'm not calling into all your meetings, I would want to, you know, stay in contact and could actually be in contact with all of you about, you know, happy to answer questions or any of that, because we wouldn't have open meeting law.
That's a lot to think about.
It is, and sorry that I just sprang it on you there at the end, but you know, this August 17th date kept getting closer, so I wanted to let you know where I was thinking with that.
Yep.
Well, I don't have any more surprises. Does anyone else?
I'm going on vacation.
Good for you.
Oh, but I mean, so I'm letting you know that I probably won't be there for those meetings. It's the 9th through the 15th.
Okay. Will you be back on the 17th? Because we can, as Jean said, change it.
Yes,
Okay.
yes.
I'm glad you're going on vacation.
Yeah.
Thanks. Too.
That's excellent. Do I have any
Jean, I
surprises?
do have a question for you.
Yes,
Jean,
Jean.
Okay.
where Laura is away this week, should I have forwarded the minutes to you my draft anyway?
No, she only just took the day off today, so yeah, no
Oh,
problem.
okay. I thought she was
She's
away.
been emailing. Yeah, no, she's been emailing all day.
Oh, boy.
Okay.
Yeah, don't ever go by when we say we're taking the day off. We don't.
Yeah, Jean doesn't work on Fridays. Not to say that we should be asking her anything on Fridays.
Oh, boy.
It is what it is.
I move to adjourn.
All right.
Second.
Good night, everybody.
Good night.
Good night.
Night.
Have a good
Have a
night.
weekend.